Good morning to all of the students of Standard 8. Last lecture we completed the first chapter and I will send the images of PDF to that question answers. Now we will continue the health and physics disease chapters. Now have you ever taken the leave from school due to sickness? You know very well. You are taking a leave either in a 6 month, 3 month or in a month or in a year for the sickness that you are not well. What happens exactly when we become sick? Have you observed when you are totally sick? You are not totally mental. We can say not in a full condition, proper conditions. Mentally you are not well disturbed. Mentally you are not well. Sometimes we feel good even without taking any medicines. You know very well. When you are not taking any kind of the medicines, then also you are completely fit. And sometimes we have to consult doctors also. And you are consulting doctors why we are not proper well. And take regular medicines in sickness. And we are taking regular medicines when you are not well. Why is it so? Have you thought why it happens? So now health. Health is a state of complete physical, mental and social well-being and not merely the absence of any disease. You know very well health is what? When the persons are completely fit. They don't have any kind of the diseases also. Totally mental, well prepared. Mentally well prepared persons. Now, what is disease? Disease, you have taught, condition of disturbance in psychological or physical process of body is called any disease. Is called a disease. Now, psychological you know very well. The persons are violent behavior, means the persons like show an angerness in the psychological or physical behavior process. On that time we can say the persons have a some kind of the disease. Now disease we can say disease has a specific symptoms. Some of the time you know very well when the headache is there, like pain, head pain, or you are feeling as a vomiting type. So that shows some kind of the symptoms that your persons has not have some kind of the diseases. Now we will see type of diseases. Type of disease you know very well. The persons are diabetes, heart attack, we can say common cold, asthma, tuberculosis, malaria, common asthma they given. Reasons and symptoms why the disease happens, and every disease has different kind of the symptoms. You know very well. The person's body has a lot of the heat. Then you are telling the persons have a fever. Some of the time the persons are feeling cold. On that time the persons are cold, some kind of the, or you are telling like in a malaria or something, or typhoid conditions. Now we will see type of diseases. Type of diseases are different type. Chronic disease. Chronic disease we can say the disease that for a long time. The disease that for a long time. Long time it can be for a month, for a year, for a lifetime also. And acute disease. Acute disease for the short time. That within 1 day or 2 days the person will be fit. But according to reasons, hereditary disease means Down syndrome. The person has a genetic. The parents some kind of a problem, then the persons we can say the child also carry that same kind of the diseases, or it might be different things. Now acquired disease. Acquired disease, that is infection disease. Infection disease that we are telling as a common cold, flu, dengue. This disease is a common thing when the climatic conditions are there. And common cold you know very well. Common cold, the person has a having a cold. It can be a malaria type. On malaria you know very well the persons are feeling a cold. In a typhoid also the persons are feeling a cold. Now flu you know very well. Flu when the climatic conditions are there, changes are there. Now non-infectious diseases. The person doesn't have infections, but that has disease also. That we are telling as a diabetes. Diabetes you know very well. Nowadays the small child also has a diabetes. Heart disease you know very well. The person's getting a heart some kind of the problems. Now just see the person's infection disease symptoms. You know very well the persons are getting a cough also, a coughing also, sneezing also. That disease, all these things are carrying a symptoms. We can say all this has some kind of the bacteria that spread in a air, and that from that air we are getting these infections, and the person also carry the same diseases. Now how do the following disease spread? Hepatitis, malaria, scabies, TB, dengue, dysentery, ringworm, swine flu. How it carries means how it spread. That we will see in the chart, that we are telling is an infectious disease. Then what do we mean by pathogen? Pathogen I already explained you in the last chapter. What do we mean by infection disease? Infection disease, the persons have certain kind of the infections, and that infection carry the other persons also. That infected same disease the person also get. Now tuberculosis. The tuberculosis, that is a pathogen. We can say Mycobacterium tuberculosis. The Mycobacterium tuberculosis, from this tuberculosis we can say from this bacteria the person also getting a tuberculosis. Now mode of infections. How the disease spread in the tuberculosis? The person has a tuberculosis, but if that person is spit, the spitting by patients, in that spitting also the person carry a bacteria. Through air, the person are coughing, from that coughing, that we can say on the coughing conditions the air carry that bacteria and the person get. Prolonged contact with and sharing of the material of the patients. If the person has a tuberculosis for a long time and the other patients are carrying, means the other persons are sharing the towels or different clothes, so the other person can also get the same disease. Now chronic cough, the cough for a long time, it can be for 20 days, month or 2 months. If this cough are there for a long time, then the person has a chance of the tuberculosis. Bloody spitting, when the persons are spitting, so on that spit the persons has a blood. Emaciations, the persons have a weak and thin, the persons feel very weak, and the persons loss of the weight. The person has a lot of loss of the weight, difficult breathing, the persons can't breathe properly. The persons can't breathe properly, the loss of the weight also there in the tuberculosis. Now the person has to prevention and treatment. What kind of the prevention we have to do? BCG vaccines are there. These BCG vaccines the person has to take. The person has to take for 15 days also, for a month also, according to doctors. Now isolation of the persons. The persons has to shift on particular place. The person does not visit here and there. That they are telling as an isolation of patients. The person has to stay on a safe place, on a proper place. Now regular medicines like DOT. DOT means directly observed treatment. To use number of the TB patients. For a TB patients they are using a medications. In a municipality if you will go, they are giving a certain kind of the medicines, and the person has to eat regular day or alternate day that medicines they are eating. In the case of the tuberculosis, the persons has to eat more and more food, so that they can get their body weight easily. Hepatitis, we are telling as a jaundice. Hepatitis virus, that is A, B, C, D, E. The contaminated water are there. From that contaminated water, the proper water is not proper, they are telling. Sharing of the needles. The sharing needles you know very well. Even we can say the doctors, every time you observe when the doctors are injecting, they are always taking a new injection or new needles they are taking. They are not taking the same needles. They are telling sharing of the needles. From the sharing of the needles also get the person jaundice, we can say hepatitis. Blood transfusion. In the blood transfusion, if the persons has a jaundice and their transfusion of the blood can take place. If the same person, the person is a jaundice and that persons are giving the blood to the other one, so the other person also get the jaundice, they are telling. Anorexia, they are telling loss of the weight. The person are not eating any food properly in this case. Loss of the weight, they are telling, they are always refusing the food, they don't want to eat the food in the anorexia. Yellow urine, you know very well. When the persons are more ill, in the case of the jaundice, the persons when the urine take place, So the fully the urine like in a yellow type. General weakness. The body is not in a proper conditions. The loss of the weight will also take place. Then they are telling nausea. The person feel stomach pain. The person feel like in a stomach pain and they feel like in a vomiting, but the vomiting not happen in the nausea case. Vomiting. The vomiting also then can take place, and the grey stool. The stool you know. The stool like in a fully grey type. Now in this case the person has to drink a boiled water. The person has to drink a boiled water and proper cleaning of the hand. Every time the person has to clean their hand properly in these conditions. Okay, we will continue the next lecture, the next topic and continuation of this infection disease on the next lectures.